Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our update on the pandemic across the country, in Maryland, and here at GBMC. So the news, again, is generally good. In Maryland, the test positivity rate is down to about 3.5%. It had been up significantly from that about a month ago. And for the first time since early August, the number of people sick enough to be in the hospital is now below 600. And that is a combination of those that are in regular beds in the hospital and also in the intensive care unit. Why is this occurring? It's occurring in large part because of the work of the people that have gotten vaccinated. So we now have, through a combination of the people that have been vaccinated, which in the state of Maryland is up above 70%, and the fraction of the population who have not been vaccinated but have some degree of immunity because they got the disease, there are now fewer people that can readily spread the disease from one person to another. So we're seeing the rate of disease go down. Now, barring the presentation of a new variant, it is likely that the pandemic will continue to fade into the background such that by March, we will no longer have the disease in epidemic proportions. The message must continue to be, get immunized if you haven't been. And now we have the possibility of booster shots, third shots or second shots for people in certain categories. Those categories are people greater than 65 years of age, people who have underlying significant health conditions, and people at high risk because of their profession. At GBMC today, we have 15 patients who are COVID-19 positive, which is about where we've been now for quite some time, and we expect that number to go down over the next few weeks. There is also good news on the way for immunizing children ages 5 through 11. An FDA panel has approved emergency use authorization for the Pfizer vaccine for children 5 to 11. We are awaiting final authorization through the Centers for Disease Control, but it is likely that within a month or so, we will begin immunizing those children. I heard a statistic just this week that in the past year, COVID-19 is the 8th most common cause of death in children. So if you're a parent, the downside risk of the vaccine is extremely small, and the risk that your child would get very sick or even die is small, but is greater than the risk of the vaccine. Another really good reason for the children to get vaccinated is to assure ourselves that they are not spreading the virus to other people, like grandparents, like friends and family members who have chronic illness, who may have been vaccinated but could still get a breakthrough infection. So we want all of our children to get vaccinated as soon as the CDC gives the final approval and the vaccine is available. So, in general, the news is good. We're moving along steadily. Although mask mandates are likely to be going away over the next few months, you may still want to wear a mask to protect yourself and others when there are outbreaks of other respiratory pathogens or you yourself are sick. It's always a great idea to wash your hands as well. So thank you for everything that you've done to get us to this point. We're almost there, not quite. Please keep it up. Thank you to our fabulous healthcare workers as well. Be safe, and we will see you again soon. If you need our help, we are here to help you at GBMC.